my Pocket Preceptor podcast. Today, I have the pleasure, the absolute pleasure of interviewing an amazing nurse that I met on LinkedIn. She was so inviting, and I'm so grateful that she decided to share her expertise and her knowledge. Her name is Alexis. I'll let her tell you all about herself. But as you know, on this podcast, we are really here to empower new to practice nurses, to help you build your confidence and your skills. Don't forget to like and subscribe and tell your friends all about us. So thank you for joining in on this episode. Alexis, take it away. Please tell us a little bit about yourself and why you decided to become a nurse.
Absolutely. Well, thank you so much for having me, Tanya. But my history includes I've been an LVN for 10 years. So I just made the transition and graduated with my BSN in December. So we're still within like the first 6 months of transitioning. I just was Thank you. I just was hired at a county hospital near my house for PCU or progressive care unit, which is also overflow for ICU. So I'm being cross-trained in ICU as well. So very excited about that.
Yes.
Still nervous, everything being new, definitely don't have any confidence yet, and imposter syndrome is real. So that's where we are.
On every level, it's real. So excellent. Excellent. And I really love how you just jumped in. You knew you wanted to do some form of ICU and you decided to go to PCU. What made you do that first instead of a med surge, which oftentimes there's a lot of people making that recommendation for new nurses?
I think that definitely on a personal note, I'm just a person who really knows what they want, and I make really long-term goals for myself. So working in critical care, ICU has been the goal probably since the day I started my BSN program. And working those 10 years as an LVN gave me the opportunity to meet, a whole bunch of different types of nurses, because I did work in a hospital setting as an LVN. So ICU sparked my interest. So I would always talk to my ICU nurses and just try to get advice from them about how to go about, were you able to get a new grad program in ICU? Like how was it transitioning, as a new grad into such a high acuity area, which, you don't get that much experience in whatever school you go to in critical care. And everyone's feedback was just really, you don't have to start in med surge, go for what you want. But just like we know, nursing is a constant learning environment, and there's no difference, in school and what you're going to do. So you might as well focus, on what's going to make you happy, where you want to be. So I had that goal in school. I knew what hospitals were willing to train in ICU. So those were kind of, on my radar. And I started applying probably month of graduation. I started putting feelers out just to see, because here in California, some hospitals will hire you with a conditional offer before you pass NCLEX. So I was trying to feel the scene. And I actually was hired at the hospital that everyone recommended, which would hire grads in ICU. So
great points. The first one being you knew what you wanted. So you have a goal in mind. You made long-term goals, as you said, and then you're able to work backwards from where you are right now, knowing where you want to go. And I see that is very important. And a lot of people may ask, should I go back to NP school? I have that question a lot when I do lives on social media. And my thing is, you need to know what you want to do. Look where you want to see yourself in 5 years, and then start working towards that from right now. So I think that's just very great that you know yourself and you know the goals that you want and you know the roles that you want to. So that's very good. And then the other thing is that you were planning ahead for these interviews at these different hospitals. So some of the things that will help you to, again, build your confidence is to know that you are valuable and that these hospitals need you. And so what you did is that you reached out to them. What are some interview tips that you would give? Would you say that recommending shadowing the floor? I often tell nurses to shadow the floor for perhaps a couple of hours to see if that is a right fit for you.
Right, definitely. Having some experience firsthand, just seeing the type of patients that you'll be caring for, definitely it might change your mind. It might not be something that interested in. So that was something I was able to do just because of the setting that I was in as an LVN. Was, I was often up on the ICU floor doing other things for like employee health, where I was able to see the patients that I thought I wanted to care for. So that was definitely one thing. And then it also aligned obviously with my future goals. But as far as interviewing, I feel like the interview process nothing has been the same with any of the interviews. Some interviews were more focused on, okay, we're going to give you these case studies and let's see how you respond to, this patient scenario. Some interviews really just wanted to hear more about my background. And they were just more concerned about, do you have any type of experience, in critical care, in ED or anything like that we can kind of build on. So I definitely would recommend, if there's any student nursing positions at your local hospitals, even while you're in school, where you can gain the type of experience that you want, in the department that you want, even volunteering, even, if you have some spare time, you can volunteer at a hospital and they'll put you in the unit, that you desire just as a volunteer. You may not be doing nursing work, but starting at the bottom is real. You know what I mean? Like knowing what type of supplies your nurse is going to need for a certain, bedside procedure, or, how to stock the unit. Something just as simple as that may give you an advantage, in the interview process. So really anything that you can do, talking to other nurses that work in the department that you are looking to work in, and just seeing what type of experiences they would want to see in a new grad, that they might be working alongside of. So, yeah.
Absolutely. So many great points. And then just finding someone who's actually doing what it is that you want to do. A lot of successful people say that, number one, key gem, find a mentor, okay? Whether you pay for them or whether it's someone on the floor that you like, how they do their work, find a mentor. That is the cheat code that
exactly.
Absolutely.
So, definitely.
Yes, absolutely. So your new role started. I'm so glad that you got the position that you wanted in the hospital that you wanted. So are you going to be working night shift, day shift, or do they rotate you on that particular floor?
So at my hospital, we're just within the first week of training. I haven't even hit the floor. I'm just now getting matched with my preceptor. I know that I will be working nights. And as a requirement of the facility I'm working at, you do have to do rotating weekends. So it would either be a Saturday or Sunday day shift, or a Friday and a Saturday night shift every other week. Okay. So interesting. I know that's not the case to everywhere, but, it's still a new nurse. Sometimes you're willing to, give and take with certain things. So that was fine with me.
Absolutely. And so we hear a lot I hear a lot on social media that go to California, get your California license. They make so much money over there. What did you find with that regarding your finances and did you apply to the hospital that would pay the most, or was it more of the training and the relationships that you would make on the floor? What were some of the determining factors with choosing that particular
question? So I put feelers around everywhere just because I didn't want to be boxed in a corner either. Even knowing that I wanted ICU, I knew that it was kind of like a stretch, but I was like, I don't want to not have a job, So I did to a lot of new grad programs that I knew would throw me in either med surg or tele, but they were for larger organizations, which I unfortunately didn't get because I didn't pass my NCLEX in the time frame that they wanted during the application period. Like, you schedule your NCLEX and they send you an email and say, oh, we wanted you to be licensed by tomorrow. So, unfortunately, you'll have to read.
Actually.
Exactly, unfortunately. So a few, opportunities fell through, that way, but I was willing. I knew just from me talking to my ICU mentors, they recommended, look at some of the smaller hospitals that aren't, right here in this major city that I live in, because they are going to be the people that are willing, but they are also the hospitals that don't pay. They were paying probably half the rate of some of the major facilities here that are starting new grads off, at $80, $85 an hour. So working for the county, I definitely took a pay cut. I think they're starting us at like 60, which is probably really good nationwide, but for California, it's definitely a lower offer, which, I mean, if you have long-term goals, you know that, there's a small sacrifice that has to be made sometimes. And I was definitely willing to, work for a less amount of money in order to get the experience that I wanted. So, yeah.
Decision, very intelligent decision. So, talking about finances, what are some of the things that you have done? You've been in LVN for 10 years now, you're an RN. What are some things that you would recommend for new to practice nurses to save their money? For example, when I started out, that was the most money I've ever made in my whole life, right? And I was probably making more than my parents. So I was like buying a Michael Kors purse every paycheck, buying shoes, not investing, not saving as much as I should. So, what are some things that you'd recommend for new to practice nurses to have a financial stability that nursing can afford them?
I definitely, like you said, the number one thing is try to save your money. That's, most of us are coming out of school with, major student loan debt. Depending on your age, I think that's a big factor when you decided to, get your license. I'm, in my mid 30s. I have a toddler, so I think I automatically just a little bit more financially, goal orientated. I was trying to buy a home before I went to school and had to kind of put that to the side, in order to go to school. So now that I'm done, it's, those things, these other goals that I have, like buying a home are, definitely right there on my set. So I'm like, I can't, I would love to go buy the Chanel. I definitely want some more Cartier jewelry, and probably could have, but what am I going to have to sacrifice, in my long term, in order to do that? Like, I bought a new Honda Accord hybrid before I started school, just because I knew that, something that is easily maintainable, something that's not high on gas. I don't know where I'm going to be working, necessarily if it's going to be a long commute or a short commute. And I definitely did want, be throwing away money in that aspect. So I've made a goal for myself. I'm not buying a new vehicle, which I would absolutely love to go walk onto a lot and get, my dreams, and probably could afford, to pay the note. But again, what would I be sacrificing, on my long-term goals if I did that? So listening to all of my nurse mentors and nurse content creators saying, like, that's the first thing that you shouldn't do. Don't go buy the car, like hold off on the bags, like pay your student loan debt down, build yourself a savings, set up accounts, IRA, Roth. Hopefully if your employer is offering, 403Bs and 457s, try to max out as much as you can, within your means, so that you can build yourself a nice nest egg. Because I feel like a lot of people get into nursing so that we can also have some more freedom, in our lives. Most of us work 12-hour shifts 3 days a week. That's awesome. I want to be able to travel and have a lot of free time. In order to do that, I need to, have some money saved too. So
great points, especially about the investing, Roth IRAs, 403Bs. Those are some things that are a flex, okay? There's so many times my investment accounts have literally saved me. OMG, I love Apple. I love Tesla. So, and those are things that, you may have a great preceptor on your floor. They may be teaching you everything that you need to know about, a lumbar drain or an extraventricular device, or, how to set up an A-line or something like that when you're working in your setting in the PCU, or how to titrate a drip, how to titrate a nicardipine drip. They teach you a lot of the nursing core things, obviously, that you need to progress in your profession. But what is important for the community that I'm building here is for you to understand that nursing is such a great foundation for you. And it could really spring you into other things. Entrepreneurship, if that may be being a stay-at-home mom, stay-at-home wife, or spouse. Let me be politically correct. A stay-at-home spouse. Just learn these key things: paying down your student loans, paying down your credit card debt, and learning to transition, say, from a debit card to purchasing things on a credit card, but then being disciplined to pay off your credit card at the end of the billing cycle or the statement date. Those are the things that are so important. And as you're saying, it's such a great kind of like instant gratification to say, I deserve this. And you do deserve the material possession. You do deserve it, but you
Absolutely.
also deserve the financial security to know that if someone were to fire you, you'd be okay. And that happened to a colleague of mine yesterday at the institution that I work for. He told me yesterday they fired him. Literally, it was his last day. He was just closing out his grades. They literally dismissed him, and he'd been with that institution for at least 5 to 6 years through COVID, all the transitions, and they had the audacity, because they're your boss, totally fired him.
Yep.
And
Yeah,
so
it happens.
those are the things
Absolutely.
that we want you to plan for. What would you do, if you were fired tomorrow? It's a real question that can happen. So that's what we want you
Yeah.
to
I'd be
think.
looking for another job. That it would come. We would manifest it. These hospitals
Oh,
are really desperate here where I live. So, I wouldn't be the end of the world, but still it's like, did you have that savings to be able to pay your rent for next month? The car note for that, dream car that you just bought,
mhm.
So yeah.
Absolutely. So true. So in the setting that you'll be working in, how is the patient ratio? Because again, this is just from hearing things on the internet. California has a set patient to nurse ratio. What will that be for you on your floor?
Since, well, obviously ICU would still be the 2 to 1, two patients to one nurse, and then in progressive care unit would be, you could get up to four patients.
Okay. Excellent. And then for the members of our community who are watching and who are LVNs transition into their RNs, what school would you recommend? Would you recommend the school that you went to get your registered nurse degree, or do you have any other recommendations from any colleagues of yours or friends who did their
I
programs online?
I think I obviously would always, and it's not the school that I went to, I would always, always, always recommend your community college wherever you live, because that's probably the least expensive option, and will probably always provide a great standard, education in nursing. But here in Northern California, even the community colleges are waitlisted just because, there's so much interest in this field. So some people will find themselves in like, hey, yeah, I'm ready to go. I've got my prereq done. I've passed my T's exam, great scores, but it's super competitive. So a school might say, yeah, we'll waitlist you. It might be 2 years before you can start. So, I mean, if you've got goals and you're ready to hit the ground running, that might not work for you. So that's kind of that's the wall that I had kind of hit. I'd done my prereqs. I was ready to go. I was applying to community colleges and the state schools here, but just because it's so competitive, I was waitlisted for a few programs, and I wasn't willing to wait 2 to 3 years, to start a 2 year or 2.5 year program. So I went the private school route. I went to Nightingale College. They've been around for, I want to say, about 30 years, but not really very much known. They're based in Salt Lake City, Utah.
Hmm.
And I don't know how I feel about recommending them. I really feel like it depends on your situation. If you're someone who wants to get it done, and maybe you have a family or other obligations, like, hey, I can't not work during school. I think that my school definitely I would recommend it in that scenario. My school was very, um, you're able to work throughout the program. It's not like self-paced or anything. You still have class at set times, but the class offerings were at times that, maybe if you did work 8 to 4:30, you'd still be able to, register for a class that started at 6 p.m. your time. You know what I
Right.
mean? So probably a lot of work, but doable. So yeah, if you're someone who worked and had a family, it's a hybrid format school may work better for you. If you're someone who learns well, online,
Mhm.
definitely you would do great. But I know that there's some people who are just like, I can't, like, I need someone in front of me. I need to feel the text, and
Right.
all of things. Then maybe another, an actual in-person program would be better for you. I feel like I was even on the side of like, are people going to take me seriously because I did theory, through Microsoft Teams, which, I mean, I still had my professor there. We were still talking back and forth.
Right.
But people feel a way about online learning. I think we haven't gotten out of or, past that. But my program, we had on in-person, obviously clinicals, that's a requirement probably for any state. So the thing about that is we did have to fly. So we were not assigned clinical rotations in my state. So I actually had to fly to, I can't even count the places: Idaho, Kentucky, Pennsylvania, and Pittsburgh for a summer, and spend our own money to be able to obtain our clinical hours. So, like I said, I would recommend it. If it works for you, it works for you. I'm here. I got it done. I passed my NCLEX 85 questions, on the first time. And now that I'm in this first week of residency, talking to other people that have graduated from state schools, from community colleges, from other programs like mine, I feel like we are all pretty much at the same, level as a new nurse. There's things that you may be strong in, there's things you're going to be super weak in, because maybe you didn't have 5 patients during your clinical rotation that had this one thing that you should know about. But I don't feel like the expectation of a new nurse is to know everything. And a lot of people will remind you of that at, starting, is like, hey, we understand that you're not going to, know it all. This is why we have this whole program, for you to kind of build a foundation on. So yeah, Nightingale College hybrid program. If you're a mom, or, a dad, or, if you have a family, or financially you're like, hey, I've got to work, then definitely it would work for you. But if you are not an online learner and you can't figure out maybe areas that you're weak in, or take that feedback and say, hey, I'm going to go and, review this so that I can make myself feel like I've got it, then it may not be for you.
Strength, right? You're able to navigate, again, these spaces where someone isn't in front of you all the time telling you what to do. You're able to learn, reevaluate, and then take critical feedback. So that's just more commendable to you and your determination to get towards your goal. So that is amazing. And the fact that you had to fly, live in different places. What? And
yeah, no,
students have trouble getting up at 5 a.m. to get to my clinicals at 6:30.
Right. East Coast time, that really threw me for a loop, because it was like I think I did a rotation at Allegheny General Hospital in Pittsburgh, and there at 7 a.m. and that's literally 3-4 o'clock my time here. So having to adjust the first few days of your clinical rotation, but if you want it that bad, you will make it work. So
absolutely. I went to the University of Pittsburgh, actually, so I'm familiar with out in Allegheny County and their hospital. So it's a great, like, that hub in Pittsburgh is a great medical hub. They have so many like magnet hospitals and things out there. So
yeah, it was like my best rotation. I was in CVICU during that rotation, and I loved every moment of being at Allegheny. So it was awesome.
Oh, excellent, excellent. I hope you can find that in your state and where you are. I hope that's what you have.
Absolutely.
So what are some things that you did to decrease the stress in your practices in LVN and even going through nursing school? Like, it's such a stressful, unless someone has gone through nursing school or, your first year as a nurse, they may not really understand the stress level that you go through. So what are some things that you'd recommend for self-care, de-stressing, pouring back into yourself after pouring into so many of your patients?
I think that that's something that you definitely are going to have to adjust to, because just being a student and then understanding the amount of work that's required of you every single week. A lot of times you're going to want to just shut everyone out and just don't have, because I have all these things. But as long as you can get to a point where you can try to find some balance, because that's so important. Like I did well throughout the whole program, but it was a lot more stressful in the beginning when I was shutting everybody and everything out. And I just literally had my head, in the laptop, in the books, and like physical pains, I started, back pain and all the, these types of things. And it kind of started to taper off when I would at least say, I'm going to take a break. My girlfriends go out for brunch, let's sit and talk. I think we were all in school at the same time. So we would actually probably still sit and talk about school, but it was nice to get out of the house and take a break. I love the water. I will go get in the hot tub in 2.2 seconds after a long day, just to relieve some stress.
Yeah.
And really a big thing is like your nursing friends are, I don't think we like to consider that self-care, but you make really good connections. And those are like the only people who understand what you're going through. So I made a lot of friends
Yeah.
during school, and we would, if we couldn't go out, we would, we would talk on the phone about funny things that may have happened, or, what we're expecting, is about to happen. So that was probably my number one self-care, was just like my support group in nursing school. So like, don't be afraid to talk to other people in your class, or, feel like, well, these people are smarter than me, they don't want to hang out with me, or anything like that. Like, just, put your feelers out, be friendly. You guys are all going to struggle together. And then outside of that, like whatever you like to do to take care of yourself, like I was kept these eyelashes done, couldn't.
Amazing. That's one of the first things I see. I'm like, her lashes are so amazing.
Oh yeah, we had to keep that up because we couldn't have nails or anything. But I would still
Yeah.
go get a pedicure and try to close my eyes and pretend like I didn't have 6 hours of homework to go home and do. But yeah, just whatever makes you feel good, just make at least a small amount of time, for it.
And so even with when you start on the floor, I think it's very important to carry over those same things. Make sure you're taking care of yourself, whatever the physical maintenance is. In your case, you love getting your eyelashes done, getting your nails. But then also one of the things I recommend is do not compare yourself to the next nurse. Do not do that, because you're always going to compare yourself from the lower level. You're never going to say, I'm better than them. And if you do, that's still a problem.
Absolutely. I feel like I was always the one in the group, like, no, you guys, I'm totally gonna, and everyone would always lift me up and be like, if anybody has it, Alexis, you have it. Like, we're totally worried about you. So I think that was something that I even learned through the program, is I might be a little bit smarter than I give myself credit for. So yeah.
Do not compare yourself.
No.
Take the critical feedback and say, how can I do it better? Or even when you make a mistake, because mistakes are inevitable. To err is human. There was a big study that, journal entry that they did on that. So as long as you didn't intentionally kill someone, like it will work out. Like, learn to look at a situation. So for example, if you had it where a patient fell on your shift and then they ended up breaking a hip, or you gave the wrong medication or something like that, as long as they didn't surmise from they didn't pass away, then I think the weight of that would take a longer time to work through that process. But in the immediate, when the mistake happens, say, okay, it happened, acknowledge it, bring it up to the supervisors, don't try to hide it, but then also say, how can I learn from this? What could I have done better? And then that's how you move forward, not beating up yourself like, oh my gosh, I'm so silly, I'm so da 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 da. It's not going to make it any better. So
Absolutely. Even if this mistake is not yours, because I'm pretty sure I made a mistake. Maybe it wasn't found, but I remember mistakes happening, during clinical rotations, and we would all talk about it. And I think that everyone learned from the one person making a mistake. It still had value, even if it wasn't yours. So, don't jump on someone else or laugh at somebody else, because we all felt like it could easily have been one of us.
So a lot of the times we may not think of those things as self-help and self-care, but it is. If you need to journal, if you need to vent. I remember my first year as a nurse, I literally cried. If you need to cry it out, go ahead and cry it out. Get those emotions out.
If you need to lay down I think I did that before my first TESI exam. I thought I was going to pass out. So I just literally laid down on the living room floor, face down, and it just was like trying to deep breathe. So however silly you feel like it is, if it may help. So
care is very important, and you have to pour into your cup. And then other practical things too is when you're on the floor, take your breaks. Like, take your break off of the floor, and especially when you have those really hard shifts, especially when it's super busy, that's when you need it the most. That's when you need to say, charge nurse, I'm gonna go take my lunch, I have this room, and this room, I'll be back in 30 minutes, or whatever the time frame is. Take your break.
I think going outside really helps, just because in our profession we're locked inside, the whole shift. And I think the biggest help on like bad days is like literally going for a walk. Just go outside of the front door so you can feel the air. Even if it's nighttime, it helps. But definitely get some sunshine if you can, and just try to decompress. Walk around the parking lot, something like that. So I think that helps versus like just sitting in the break room and then, listening to other people talk about patients or whatever they're talking about, usually having to do with work. So,
Right.
yeah.
Right. I sometimes go on Instagram and then I just find like the funniest things, like it auto populates your feed and I will like laugh my butt off.
Yep.
That's how
Take your way.
this has been so great. I'm so grateful. I would love to have you back in the future to tell us, like 6 months post, what your experiences are on the floor and things like that. And so, where do you see yourself in 5 years, if you'd like to share professionally moving forward?
In 5 years, I definitely hope that I would be preparing myself for applying to CRNA school, if that's God's will.
Um,
I am looking at master's programs right now. I know that a lot of people love to do this like super quick jump. They get their BSN. They're like, I'm going to find an NP program, but I just personally don't feel like I have any of the, experience to be able to add another tier of learning that is that big. So I want to give myself time. So I'm looking at, just maybe a care coordination master's, even an informatics master's program, and then possibly would do like a post grad certificate once I feel like I've got, 2 or 3 years of real, experience underneath my belt to do the FNP. So I just will end with the DNP. I will have the doctor in front of my name at, before I leave this earth, hopefully. So
yes. Yes, that is amazing. I love that for you. You are so intelligent. Like even just meeting you on LinkedIn, again, guys, relationships, just go out and reach out to people. That's how Alexis and I first interacted, was on LinkedIn. So LinkedIn is a very great place to meet professional people like yourself. So go ahead and just have these people in your network, even if you physically can't communicate with them, just watch the posts that they make. You can learn from them. And to your point with going back to getting your doctorate, for those who are looking to go to CRNA school, as you're stating, there is, I think we spoke about this. Is it CRNA diversity on Instagram?
Yes, I've been following Lena Gold before I even started BSN school, because I remember I love to make these long-term goals. But yeah,
they've been working out. They just work.
Right. You got to manifest it, write it down, and look at it every day. But Lena Gold, I definitely plan on attending one of her diversity events. If I'm not able to make it this year, I definitely have plans to make it to the one the following year, so that I can meet all these amazing Black and all different colored CRNAs or minority CRNAs that are willing to, to mentor us.
It is so important to see that they've done it and they know the pathway and they're just getting us there quicker. That is the whole goal of having a mentor. So that is so wonderful to hear. And you'll definitely, have that doctorate well before you, your goal. And as you're saying, manifesting, this is so real, guys. Like whatever your religious beliefs are. And so many times you could get caught up in like the religious beliefs that you grew up on or were inundated with. But I tell people it's just like gravity. It's a law of the universe. Gravity does not care if you are 99 years old or you're 9 months old. Okay? If you get pushed off a building, you're going to fall. Right. That's the same with manifesting. The thoughts that you focus on the most, that is what you will bring about. Period. I didn't make the rule. It just happens.
Absolutely. In my office, I think the within like a few months of starting the BSN program, I had one of those little letter boards, and it said, Alexis BSN-RN, 2020, 2023. And I sat as I did homework, that it looked at me all, the whole time. So I don't know, however the universe worked. I still have it sitting there. I'm going to update it to MSN.
Yeah, surely. That's right.
All the credentials that I have goals on obtaining on that. But I think that was definitely something, seeing it every day, whether I was doing homework or not, walking past my room and seeing what I was. And it was also a reminder of everything that why am I in here crying at 11:30 p.m. Because this is what I want. So it's a good reminder to have it visually there for you, something that you can see every day. Even if working on it to remind you, I need to apply because this is what I want to do, or keep working hard because we're almost at the finish line.
So wonderful. It's been such a pleasure having you share your knowledge and your expertise. Is there anything else that you'd like to share with a new to practice nurse or a person in nursing school, or just someone who's watching this podcast today? If you could just have one last thing that you'd like to encourage them on.
The biggest thing I probably have learned this week is just advocate for yourself, and know that these organizations, they can hire any 200, 250 nurses. You're just, one drop in the sand to them. So like I said, if a goal of a certain department is what you want, speak up, let them know that, because they'll throw you wherever they want you to go and not, have any regard for you. I've even been a little bit misled on, certain things because hospitals are desperate. So just always remember to advocate for yourself. Don't feel like just because you're not this seasoned nurse that you can't, I don't want to say make demands, but, speak up, make requests. And a lot of times you'll see that some of those will be accommodated. And I feel like that's where a lot of people are led into areas that they may not want to be in because they feel like they have to. So speak up, advocate for yourself, just like you would advocate for your patients. And just for all of the minority, men and women out there, we can do it too. So don't feel like you're any less capable because you might be the only, Black or colored person, in your class or, in your new grad cohort. We are just as capable as the next person that passed NCLEX. So
I don't even want to say anything further. You are amazing. I look forward to building a more professional relationship with you. I am here for you. So for all my guests, my first esteemed guests to come on here, the first 10 esteemed guests, which you are a part of, will get a copy of my ebook for free. My ebook is called Mastering Nursing. Okay, the tips and tricks that you need to excel in this profession. And so you'll get a copy of that. We'll send it to you in your email. And then also for those who want some more support hands-on, I do offer mentorship. You could go ahead and check the link in the description for that. And I will be starting a new group for new to practice nurses. And I'd love to invite you to come, Alexis, and see if I can continue to add value to you. You've been so amazing. I'm so blessed to have come across your path. And thank you for the expertise that you've shared with our guests here today.
You too. Thank you so much, Tanya. I definitely look forward to reading the book, and definitely would love to join the group. So I definitely will see you.
Much, Alexis. Many blessings and favor to you in all that you do.
You as well. Take care.